Hi all, today we're going to be taking a look at emotional and behavior disorders. Sometimes it goes by the acronym EBD. So, what about students with emotional and behavior disorders? A little bit of background. These are students that have severe, chronic, and pervasive problem behaviors, and oftentimes they'll have one or more mental health conditions. In IDEA, it uses the term emotional disturbance. And what this means is that they have an inability to learn that can't be explained by intellectual or sensory or other health factors. They have an inability to build and maintain interpersonal relationships, so relationships with others. They often exhibit inappropriate behavior or feelings. They have great unhappiness and depression, and they tend to develop physical symptoms that are related to their fears. So, the concern with the IDEA definition is that it focuses really on emotional disturbance. And so it excludes any type of thing that's purely a behavioral problem. And it also focuses on the impact of their educational performance. So it's interpreted as only academic, and it excludes school-related social, life, or vocational skills. And it also excludes students with signs of what's called social maladjustment who may still need services to be successful. So there are two main types of EBD, and that's externalizing behaviors and internalizing behaviors. Externalizing, these are behaviors that you can see: verbal or physical aggression, hyperactivity, impulsivity, noncompliance, delinquency, versus internal behaviors. These are things that you may not be able to witness because they're things taking place usually in their mind or in their body. So things such as anorexia, bulimia, anxiety, depression, and they're really not disruptive. So oftentimes they're not going to be seen and they're not going to receive the attention that's needed from professionals. Then you also have low incidence conditions of EBD. So things such as schizophrenia. They're very, very infrequent, but it is extremely serious. So what are characteristics of students with externalizing behaviors? So these are the behaviors we can see, we can witness in the classroom. They tend to violate the basic rights of others and societal norms. They cause property damage or property loss. They can demonstrate hostility or defiance. I often argue will have tantrums. They can be physically aggressive. If you ask them to do something in compliance, they'll ignore it. They'll demonstrate obsessive compulsive behaviors. They can either cause or threaten physical harm to people or animals. They'll tend to use lewd or obscene gestures in your classroom. So these are all things that we can witness, we can see. Internalizing behaviors are going to be very different. They could exhibit painful shyness, very depressed, eating disorder, anorexia or bulimia, socially withdrawn, unfounded fears and phobias, verbalizing self-esteem, low self-esteem. They'll have excessive worries or panic attacks, exhibit destructive self-behavior, so things like cutting, or they'll have suicidal thoughts. So EBD, we look at high or low incidence. Are we having students with a lot of these and not a lot? What does this look like for us in a classroom? It's considered a high incident. So 6% of all students in special education are going to receive services under EBD. 46% of the students, and this is a large amount, are going to spend the majority of the day in their general education classroom with you as their instructor. Only 13% are served in a completely separate school, and 5% are going to receive services in a residential or a correctional facility, sometimes a private school, a home, or a hospital. When students have EBD, we have to be very careful on suspensions and expulsions. And this happens with the interim alternative education settings. And this says we can have either those alternative educational settings or suspensions for up to 10 days for conduct violation. And while the students are in these settings or in suspension, they must continue to receive education services and make progress towards their IEP goals. Within 10 days of the incident, the IEP team must determine if the behavior was a result of the disability or poor implementation of the IEP. So If it is suspension or expulsion procedures for these kids, if so, they have to and create a functional behavior assessment. And so this functional behavior assessment, I know we've talked about this previously, it looks for the antecedent, what is the cause of the behavior, and tries to stop it from happening to begin with. And so this functional behavior assessment is supposed to implement a behavior intervention, and it's going to return the child to the original placement. So rather than being suspended for longer than 10 days, we realize that this is because either the IEP wasn't implemented correctly, or it's because of the child's disability. We do the functional behavior assessment. We try some new techniques for intervention and put them back in placement. If the behavior occurred while the behavior intervention plan has already been in place, the team then has to look and say, is there something wrong with this plan? Do we need to revisit it, try something else? They could be put in an alternative educational setting for up to 45 school days for violations if we're talking weapons, drugs, or serious bodily injury to another individual. But these students, they really face some difficult challenges. To begin with, they're the poor social and academic outcomes of any of our disabilities we're going to look at. These students are more likely to fail a grade, drop out of school, be suspended or expelled. They have low levels of academic engagement, and it could be because of skill deficits because of multiple suspensions where they've been removed from the classroom. So you can have these areas where they just haven't had training. And then it could be performance deficits where they're just like, I'm not going to do it. And then they also have fluency problems because they are in and out of classrooms because of behavior issues. They don't have enough practice to really perform a skill to the point where it becomes automatic for them. And these students are also going to be in places like juvenile delinquent centers and things of that nature as well. So what are some of the ways we can help these students? What we call wraparound supports. So really strong academic instruction, and I know you're going to be really surprised to hear me say this, but utilizing universal design for learning, giving them social skills training, how to interact with others, individual behavior interventions, and oftentimes things like mental health services and medical interventions will happen as well. And then PBIS, positive behavior interventions and supports. You guys have already done a case study on this. This comes back into play for these types of behaviors as well. And it explicitly teaches what are the expected behaviors and provides progressively more intense interventions as are needed for the student. So what do we do when students come in and they've got these externalizing behaviors? Well, a lot of this is going to be proactive. So things you have to plan in advance and practice in advance. One is establishing clear rules with consequences that are consistently applied every time they occur. Reducing extra noise and distractions, that idea of making assignments more brief, allowing more breaks, providing options. That's one way to get out of a power struggle with a student with externalizing behaviors, is to provide an option for the student. It allows them to feel a measure of control. And then utilizing small group instruction because it helps keep the student focused and helps with controlling behavior. But what about students with internalizing behaviors? Give them prompts to help them get started, note takers, breaks, alternative testing locations, preferential seating to reduce anxiety, and then extended time for tests and assignments, because that's just going to reduce their need to rush through and complete it and the stress that happens because of that. So how do students develop EBD? Well, there's a lot of different risk factors, and some of them include maternal drug and alcohol use. Poverty in itself raises the chance of EBD, abuse, neglect when parents are stressed all the time, exposure to constant violence, inconsistent expectations and rules, and turmoil in the home. A lot of these are going to be learned problem behavior because they're imitating those around them. And some students will develop problem behaviors as a coping mechanism because of the stress that's occurring in their lives. And some of them will have mental illness, which is triggered from different psychological trauma. So how do we identify this at an early age? So the problem behaviors, things like extreme anxiety, excessive worrying, hyperactivity, frequent nightmares, disobedience, frequent temper tantrum, calling names. Like some of these are normal. It's normal to worry a little bit. It's normal for little kids to be bouncy. It's normal for toddlers to throw a temper tantrum. What's not normal is behavior is excessive and pervasive, so it continues well beyond the bounds of what is developmentally appropriate. So effective early intervention programs are going to include active parent involvement and teaching through examples, the idea of modeling relationship between behavior and consequences, and instruction on appropriate behaviors in different settings, and how to make and keep friendships. So increasing positive behavior and reducing problem behavior happens by using an effective classroom behavior management system and utilizing those effective teaching materials. You have all your things ready. You're beginning instruction promptly. You know how to get your students' attention, and you're providing different types of organizers for them, giving students opportunities to respond in specific praise for students, scaffolding to help assist them, and corrective feedback when they need that extra help. So what about students who are going to need even more than that in your classroom? Because that primary prevention is not effective for all students. Secondary interventions are going to happen, and these can happen in small group or individualized, and these are going to be specific skills on social instruction where students are checking in and checking out. And then you're going to have these third level, the tertiary interventions, and this is for the most chronic, most severe, most pervasive problems, and you'll be doing those functional behavior assessments at this stage to figure out what is the cause of the problem behavior, and then develop a behavior intervention plan where you learn to stop or attempt to stop the behavior before it even begins. So what about these kids after high school? These students are going to have the highest rate of disciplinary actions. 63% of suspensions and expulsions are going to be these students, and 73% of all students with disabilities are going to have suspensions and expulsions. The lowest rate of high school completion at only 56%. These guys are also going to have the lowest rates of college attendance, high rates of unemployment and underemployment, and high job turnover, poor interpersonal relationships, need for mental health services, delinquency, criminal actions, all of these things. But what do we do to improve this? Because this is not okay. We want these kids to succeed. So social skills instruction, how to interact in society, how it is appropriate to behave, including them in general education classrooms so they can model behavior of those around them and see how it is they need to behave. High school completion or graduation, support them through that. Instructions in self-advocacy, how to know what you need and how to express what you need. Provision of career awareness activities, so letting them know all the different jobs and things that are available for them. Integrating interagency collaboration, so you're working with the school and mental health departments and job training to work with these students, and social network developing, getting them a group of friends. So there are different organizations available for support for parents to reach out to when they're at the end of their rope. And the Center for Parent Information Resources, the National Alliance on Mental Illness, and so you can direct parents to some of these. The PACER Center is going to help families with support, workshops, and referrals to other agencies. And now the problem is how we identify. Males, especially African Americans, are far more likely to be identified in the EBD category than females. And African American youth across the board are more likely to be suspended, arrested for violent crime, receive a residential placement, or be prosecuted in an adult court. And how do we stop over-identifying students with EBD? 0.5 of students receive services for EBD, but the prevalence is closer to 3 to 6% who actually have it. Many students with EBD don't receive services because the IDEA definitions are unclear, as we talked about earlier. A lot of parents don't want their child labeled as EBD because of the negative connotations that are associated with it. There's oftentimes limited services available for these students, and there's under-identification of internalizing behaviors or even mild to moderate because there's not things you can actively see. But as teachers, we need to advocate for these kids and help them be successful.